and welcome to this week's presentation for HSC2102, in which we're going to be covering systematic reviews and just a brief overview of systematic reviews with the main focus on how to read forest plots or the meta-analysis component of systematic reviews. So like always, here are the objectives for this week. Please use them to assist with your study for the upcoming exam. Like I always say, the lectures fairly much map to the type of MCQs that you'll expect, with the tutorial activities representing mostly the short answer type of questions that we'll ask. Okay, so just a bit of a recap once again why we practice, I guess, evidence-based practice and the importance of evidence-based practice. In week one, we defined what evidence-based practice was, so hopefully everyone can remember that. The key aspects of EBP being clinical expertise, so whether that be from a doctor, nurse, physio, occupational therapist, psychologist, public health practitioner, whatever it may be, but it's that clinical or content, I guess another way of thinking about it, content expertise. Integrating that with the patient values and preferences, because at the end of the day, it's the patient's body, so they've got full rights in terms of what decisions they want to make, but hopefully what we want to do is inform this decision making that is going to occur here by the best available evidence. So obviously evidence-based practice integrates the best available evidence, whatever that may be, whether it be randomized controlled trials, whether it be case control studies, whether it be a one-on-one interview. They're all relevant to that particular scenario. So integrating the best available evidence with the clinical expertise or content expertise and the patient values. So why, I guess, do we want to practice evidence-based practice, and where do systematic reviews come into effect? Well, the one thing, and I hate to break it to everyone, but it's reality, you're probably going to know as much as you're going to know, if that makes sense, while you're at university. So your levels of knowledge about a particular issue are going to be quite high, particularly as you're studying for exams, and this is a particular example looking at how to treat hypertension and the best available care here. So this is a survey of doctors in this instance, and just at post-graduation, their knowledge or levels of knowledge on this particular issue was at its peak, and unfortunately it's a slippery slope as you enter the workforce and other things take over. So I guess what we're trying to get at is you don't need to know everything. What I guess the key is in terms of clinical research particularly is having the tools to identify and obtain information to fill that knowledge gap. And this is where potentially systematic reviews can come in handy, because they offer this opportunity to access high levels of evidence that have already been summarized for you. So just further, I guess, emphasizing this notion that you can't keep up with the ever-growing literature and the amount of knowledge that someone actually needs to effectively work in whatever role that they're employed in. So this is actually quite an old article, as you can see, in the mid-80s. So the internet wasn't even around, so you can imagine how much time they would have lost trying to find books and journals in the library. But basically it was a survey of GPs in Los Angeles in the US. They had 2 new questions crop up for every 3 patients they saw, which, if you think about it, 16 questions per day, 80 questions per week, not going to happen. Not going to have the time to actually go off and try and find that information. That is, again, I guess again highlighting the fact that we need to have these tools and skills to be able to source relevant information when we need it. Again, just highlighting the amount of information that is continually growing. Look, clinical research is a huge area at the moment, and if you just look at the amount of information that's published in Medline, so these are the good quality articles being published on Medline and indexed. The amount of information is doubling every 20 years, which is staggering when you, hopefully in the next slide you'll see how many articles are published per year. So again, just I guess to highlight here, when we're looking at the number of articles published per year, this graph being overall, and this graph over here relating to randomized controlled trials. Most of them are clinical trials. So in early 90s we had about 5,000. By the early 2011, 2012, that had increased almost sevenfold. Excuse me. So you can see the amount of information that we're having to contend with, even if you break it down to specializations, is quite large. So again, having the option to access information that has already been summarized will save you quite a bit of time in the clinical environment. So once again, I'll highlight the evidence-based practice process. So step one, you formulate a clear clinical question, and that is using the PICO structure, so patient, intervention, comparison and outcome. You search the evidence, primarily through Medline, whether it be through Ovid or PubMed, but there's also other databases out there specific to areas. So for instance, if you're interested in psychology and psychiatry, there's PsycInfo, which is a specific database, you can access that. Similarly for physiotherapy and allied health sciences as well. The third step, we appraise the evidence, and that's what all of you have done with that latest assessment task. So you're very familiar in terms of how to pick apart the evidence to identify whether or not the evidence is good, bad, or otherwise indifferent. And then the last part is, some will say, or some would argue, the fun part, and that is integrating it and coming at an informed decision with the patient or stakeholder or whoever it may be, using the evidence and your content or clinical knowledge. So here we have the evidence pyramid. So usually what we see are RCTs up the top, and if you look at this particular instance, we've got the RCTs on top of the studies that we've described so far, so that being cohort studies, case control studies, case series, etc. RCTs are at the top of the pyramid, basically because they control for the four main biases. And once again, I'll highlight, if you understand those four main biases and what they are and how you account for them, you've got a very good understanding then of clinical research. So those four biases being selection, performance, attrition and detection bias. Now, systematic reviews are put up the top only because they're an overview of all the studies below them. So you can have systematic reviews of randomized controlled trials, you can have systematic reviews of cohort studies or case control studies. Obviously, the higher the type of study that you've got, the better the quality of the systematic review. So what are systematic reviews? And what are the barriers that keep people from utilising information or keeping up to date? Several resources. The main one, and the one that we can't do a whole lot about, is time. People are just time poor. People don't have time to read up on the latest literature, go out and find, search articles through Medline, etc., etc. So systematic reviews offer a method in which information can be summarised and can be directed across in a sort of a Reader's Digest form of information. Other aspects include resources, so that being an example being able to actually access articles. Unless you're affiliated with a university or a hospital, you have to pay for articles, and I think that you've probably got better things to spend $29.95 on rather than the latest article from the European Journal of whatever it may be. And finally, knowledge. It's a specific art form. Clinical research, finding evidence, appraising it. Not a whole lot of people out there know how to do it. And if they don't know how to do it, they're relying on others or bringing others into to do it. So hopefully guys like yourselves who will have the expertise to broker such knowledge. How many types of review can there really be? You hear about literature reviews, systematic reviews. How many are there out there really? A bucket load. There's quite a lot. They all mean pretty much the same thing with slight differences. The one that we're going to focus on is a systematic review. Now, systematic review is sometimes called a meta-analysis incorrectly. So they both have common components in terms of the search, in that the search is comprehensive, whether it be a meta-analysis or a systematic review. Systematic reviews also include an appraisal aspect, so essentially what you have done for the last assessment task in appraising articles for selection, performance, attrition and detection bias, and they do have some type of analysis. Now, sometimes people call a meta-analysis a systematic review, a systematic review a meta-analysis. Technically, the systematic review part is the searching and quality part of doing a systematic review, and the meta-analysis is really the analysis part. But I'll put up this slide just so you're aware of that these terms are used interchangeably. What is the difference between a normal review or a literature review, I guess, narrative review sometimes they're called, and a systematic review? Well, if you think about whenever you've been asked over the last few years to do a literature review on a particular topic, what have you done? And you can be totally honest because I can't see you and hear what you're going to say. But you think about it, you've got a particular topic, you're going to find information that supports the argument that you want to run with, and you're probably going to ignore any other article that offers contradicting information. A systematic review, on the other hand, tries to be as transparent as possible. So there's a clear methodology associated with the systematic review. There's a specific critical appraisal aspect of all of the studies that you include in the systematic review, and then there's usually some sort of synthesis of the data in order to get an overall pooled result. So again, just highlighting, I guess, the differences between systematic and traditional reviews. Traditional reviews, so literature reviews, very subjective in nature. You don't actually have to show what you've searched. There's no criterion in terms of I searched for RCTs or I searched for case series or whatnot. There's no synthesis of information, and there's no real discussion on with respect to the quality of the studies that you've included in your literature review. Conversely, like I said, systematic reviews, very, very transparent, a very clear process, and essentially it's just another form of research methodology. So it's kind of like doing a randomized controlled trial or a cohort study. There's steps involved in a systematic review that you must do in order to minimize bias and in order to get the result that you're after. In this case, the overview and synthesis of literature on a particular topic. So as I mentioned, a systematic review needs to be transparent. There are specific steps in a systematic review. The first one being that you need to structure a formal clinical question using PICO. So then, if you haven't already picked up on it, is step 1 in the EBP process. Step 2 of the systematic review is to conduct an exhaustive search of the literature, including an overview of what your search strategy was. Step 2 of EBP, and again the step that you've included in your previous assignment as well. There's an inclusion-exclusion criteria in terms of studies that you want to include or otherwise reject for your systematic review. The third step then being the the assessment of the quality of the study. So the critical appraisal, again mirroring step 3 of the EBP process. And then step 4 is the synthesis of data across all of the studies that you've included in your systematic review. So even though we sort of praise the systematic review, as I mentioned, there are instances where bias may still occur. So again, if you're conducting a systematic review of RCTs, the systematic review is going to be fairly good in terms of a quality point of view, as opposed to a systematic review of cohort studies or whatnot. There are biases specific though to conducting a systematic review, and they may relate to the type of inclusion criteria that you've selected, so whether or not you've made the inclusion criteria too specific, the literature search, that is whether or not you've only searched one database. So the key for systematic reviews is that you need to search as widely as possible. So search a variety of databases, a variety of abstracts, conference proceedings, anything that you can get your hands on in order to make the search as wide as possible and cast the net as far and wide as possible. And then the third thing is this thing called publication bias. So that is somewhat out of the control of those doing or those conducting the systematic review, because this really relates to whether or not a study has been published. And as we've discussed in the past, authors, hopefully not so much these days with the inclusion of the All Trials Register and other registers that we talked about, if their study, I guess in the past, hasn't been what they expected in terms of the results, sometimes authors haven't published the results of the paper or have been very slow to do so, and so it won't necessarily come up as a citation in your original research or search of the literature. So again, that's one publication bias is one bias that we can't necessarily account for. So again, just highlighting the biases. So the inclusion criteria bias, it should relate specifically to the PICO question, and there needs to be reason as to why you're including certain studies and excluding other particular studies. So it needs to be, I guess, pragmatic at the very least. Inadequate literature search, as I said, again, we can account for this one. So searches aren't just limited to Medline. Searches need to be broad across a variety of databases, and as I mentioned, using resources such as conference proceedings and other avenues in which newer articles, for instance, may not have yet been included on Medline. So there's other registries and whatnot in which you can search to identify whether or not a study is to be published sooner rather than later. Publication bias we mentioned. I guess these reasons for publication bias aren't as common now as they were, let's say, 10 years ago. So things like time lag bias. So the fact that you've got pretty much all journals these days are available online. You haven't got this period in which you get an article accepted and then it takes 6 to 12 months to publish. Similarly with English language, pretty much all journals only publish in the English language. Okay, so one of the things that I guess separates Sysmac reviews from other reviews and what makes them so important and so respected within the medical and health science community is the fact that Sysmac reviews have this inclusion or exclusion of studies based on their quality. So each article or each study that is included in a systematic review, like I said, will be assessed for their quality according to the various biases that we mentioned, and then based on that, it provides us with a really powerful effect because we can separate studies into those that we deem to be of good quality and those that we deem to be of poor quality, and then we can make judgments based on the quality of evidence, and I'll give you an example of where that's been, I guess, of importance in the medical community over the next few slides. So that wraps it up for part one. Part two, I'm going to focus on the meta-analysis. We're going to keep it simple, and I just want to focus on how to read and how to understand what a meta-analysis is. So until then, see you at the next presentation.